Okay, so um, we've got a ton of questions about bird flu and, like, specifically this new case in Louisiana.
Yeah, it seems like this is kind of what everyone's freaking out about right now.
Yeah, so we're doing a deep dive into it today,
Mm-hmm.
and we've got a lot of interesting sources to look at.
Yeah, a lot of different stuff. A Reddit thread that you sent us,
Mm-hmm.
some news articles, and even a Wikipedia entry in Arabic about H5N1.
I know, right?
It's
So wild.
it's everywhere,
Yeah.
seems like.
Yeah, before we get too far, let's back up for just a sec.
Sure.
Like, why is everyone so freaked out about this? I mean, we've always had bird flu.
Well, I think one of the things that makes this so interesting and like kind of scary is
Yeah.
that you've got sources in English
Right.
and in Arabic about this, and that shows you that like this is a global thing. It's not just limited to one place.
Yeah, and then I think what really got everyone's attention was that headline.
Yeah.
Louisiana resident hospitalized with H5N1.
Yeah, it definitely makes you stop and think, huh?
Yeah, for sure. So, okay, for anyone who like needs a refresher,
Mm-hmm.
what exactly is H5N1?
H5N1 is a type of influenza virus,
Okay.
but it's different from the kind of seasonal flu we usually think about because this one mainly affects birds. And the thing that really makes it a concern is that it can sometimes like jump from birds to other species like people.
Yeah. And we're not talking just like a little cough here, right?
No, definitely not.
This thing can be pretty serious.
Yeah, if you look at the Wikipedia entry,
Mhm.
even though it's in Arabic, it's pretty clear this particular strain can be deadly.
Okay, so that's unsettling. We've got a virus that could be deadly to humans.
Right.
It can jump from birds to humans.
Mhm.
And now we have this first case in Louisiana.
Exactly. And it sounds pretty serious. I mean, the Louisiana Department of Health info in that Reddit thread said the patient's been hospitalized.
Right, in southwestern Louisiana.
Yep. And they think they got it from being around sick or dead birds.
Okay, so right away that makes me think like this wild birds or birds from like a farm or what?
Yeah. Good point. We don't really know the details yet.
And how much contact did this person have with the birds? Like, were they a farmer or just someone who like walked by a sick bird?
Those are the questions everyone's asking. And those answers are going to be really important for figuring out how worried we need to be.
Yeah, so like if one person got it this way, are other people at risk too?
That's the million-dollar question, and it's why everyone is watching this case so closely.
So do we know how big of a risk this is for people who aren't around birds all the time?
Right now, health officials are saying the risk to the general public is low,
Okay.
especially for folks who aren't handling birds regularly. But for people who do work with poultry, the risk is definitely higher.
That makes sense. Okay, so we've got this case in Louisiana that's making everyone nervous.
Understandably.
But this Wikipedia entry reminds us that, like, this isn't a new problem.
No, it's
H5N1 has been around the world for a while.
Yeah, it mentions millions of birds dying and like these massive culling efforts to try to contain it.
So they're, like, constantly battling this thing.
It sounds like it, especially in Southeast Asia.
Yeah, it really makes you think, like, what can we learn from those countries that have been dealing with this for so long?
Yeah, maybe there are strategies they're using that we could adopt here in the U.S.
Yeah, because it's obviously not just a Louisiana problem. This is like a global thing.
Yeah.
And we're all connected.
Exactly. Diseases don't really care about borders.
Well said. And speaking of the bigger picture, one of the Reddit users brought up this really interesting point.
Yep.
Like, are we actually seeing this virus get better at infecting humans? They pointed out that last year we saw a lot of poultry farms getting hit hard with bird flu,
Yeah,
but we didn't see a bunch of human cases.
right.
So is the virus evolving? Is it getting better at jumping to humans, or are we just getting lucky so far?
It's a really good question, and it's something scientists are definitely trying to figure out.
Yeah. I mean, is this a sign that a pandemic could be coming?
Well, that's what everyone's worried about, and another Reddit user brought up something that adds to that worry. All this talk about removing childhood vaccines,
Oh, yeah.
that could make outbreaks way more likely.
Yeah, that's a whole other can of worms.
It is, and it connects directly to this idea of, are we prepared for something like this?
Right. Like, are we setting ourselves up for disaster?
It's a valid question, and one we need to take seriously.
Okay, so we've got a lot to think about here.
We do.
We've got the virus itself, we've got the potential for a pandemic, and then we've got all these societal factors that could make things even worse.
Yeah, this is a complicated issue with a lot of moving parts.
For sure.
Ow.
So let's unpack this a bit more and try to make sense of it all.
Sounds good. Let's dive in.
All right.
I'm ready when you are. It's a tough issue, right? Like, there's so much fear
Yeah.
and misinformation about vaccines, but the science is pretty clear.
Right.
Vaccines have been super effective at preventing and controlling, like, tons of diseases.
Totally. It feels like we're having two different conversations here, though.
Yeah, I see what you mean.
One about the virus itself, and then one about, are we actually prepared as a society to deal with this?
Absolutely. And those two conversations are definitely linked. You know, even if this doesn't turn into a full-blown pandemic,
Yeah.
any kind of outbreak could be really bad.
Right.
If we don't have the tools to
And
respond.
the trust in those tools.
Exactly.
Right.
Okay, so let's get back to the virus itself for a minute.
Okay.
How does this thing actually spread? We know it can go from birds to humans,
Right.
but how does that actually happen?
Yeah.
The main way is through direct contact with infected birds, their droppings, or even surfaces that have been contaminated.
Okay, so like poultry farms.
Yeah, exactly.
Yeah.
Workers on poultry farms are handling birds all the time.
Right.
That's a super high-risk environment.
Makes sense.
Yeah.
But what about for the average person who isn't working on a farm?
Right.
Like if I see a sick bird in my backyard, should I be worried?
I mean, the risk to the general public is still considered low,
Good.
but it's always smart to be cautious. The Louisiana Department of Health says you should avoid contact with any sick or dead birds.
Okay.
And keep your pets away from them, too.
Got it. You know, I have a friend who has chickens in her backyard.
Oh, yeah.
I bet she's feeling a little uneasy right about now.
I can imagine. For people with backyard poultry, it's extra important to be careful.
So, like, what kinds of things should they be doing?
The big thing is biosecurity. So like washing your hands really well after you touch the birds, keeping their coop clean and disinfected, and trying to keep wild birds away from your flock.
Okay, so basic hygiene goes a long way.
It really does.
But what about the food we eat?
Okay.
Can you get H5N1 from eating chicken or eggs?
That's a common question. And the important thing to remember is that properly cooked poultry and eggs are totally safe.
Okay, good.
The virus is killed by heat, so as long as you're cooking your food to the right temperature,
Right.
there's no risk.
Whew. Okay, that's good to know. I was about to swear off omelets for a while.
No need for that. Just make sure those eggs are cooked through.
Yeah.
Deal. So we've talked about precautions and all that,
Right.
but I feel like we still need to address the big question.
Okay.
Are we on the verge of a bird flu pandemic?
That's the million-dollar question, isn't it?
It is.
It's really hard to say for sure.
Yeah.
We've seen these sporadic human cases before,
Yeah.
but they haven't led to widespread outbreaks.
Right.
So the key thing scientists are looking for is sustained human-to-human transmission.
Because right now, it seems like most cases are from direct contact with birds.
Exactly. If the virus were to change in a way that let it spread easily between people,
Yeah.
that would be a whole different ballgame.
So that's why they're doing all this monitoring and surveillance.
Exactly. They're trying to catch it early if it starts to happen.
So they're basically watching to see if the virus starts getting better at spreading between humans.
Yep. They're looking for any signs that it's evolving in that direction.
So like looking at the virus's genes.
They're looking for mutations that could make it more transmissible or more likely to cause severe illness. Okay, so let's say they find those changes.
Okay.
Then what?
That's where things get tricky. We do have some vaccines that offer some protection against certain H5N1 strains,
Okay.
but they might not work as well against a mutated strain.
So we're in a race against time here.
It kind of feels that way. Scientists are constantly trying to stay ahead of the virus.
Always trying to predict what it's going to do next.
Yeah, it's a tough job, but they're doing amazing
We're
work.
monitoring the virus, developing new vaccines, researching treatments.
It's incredible what they're able to do.
It is.
Right.
But even with all that science,
Right.
we need people to trust it.
Exactly. That's where the whole vaccine hesitancy thing comes back in.
Yeah, because if people don't trust the vaccines, they won't get them.
And then the vaccines can't do their job.
It's like we're fighting two battles at once.
I know, it's crazy. The virus itself,
Yeah.
and then this battle against misinformation and fear.
And honestly, that second battle might be even harder to win.
It might be. It takes education, open dialogue, and building trust between communities and public health experts.
You know what? This whole Louisiana case has really made me think about how connected we all are.
Yeah.
Not just globally, but even in our own communities.
It's true.
What happens in one person's backyard can have ripple effects across the whole country.
It's a good reminder that we're all part of this bigger system.
Right. And our health is tied to the health of animals and the environment.
You're talking about the One Health approach.
Yeah, exactly.
Yeah.
That idea that human, animal, and environmental health are all interconnected.
It's a powerful concept, and it's
Yeah.
really important for understanding and addressing a threat like H5N1.
Because we can't just separate ourselves from nature.
We try, but it never really works.
It's impossible and it's harmful.
Exactly. We're part of these ecosystems, whether we like it or not, and our well-being depends on the health of those systems.
So it sounds like a pretty complex puzzle to solve.
It is, but it's one we need to solve together.
Okay, so who needs to be involved in solving this puzzle?
Everyone, scientists, public health officials, policymakers, communities.
Wow,
We all have a role to play.
that's a lot of people.
It is, but that's how important this is.
Okay, so we've talked about the U.S.,
Yep.
but what about the global perspective? We talked about Southeast Asia earlier.
Right.
How are other countries dealing with this risk? Are they like constantly on edge?
I mean, it varies from country to country.
Yeah.
But a lot of them have learned to live with H5N1 as an ongoing threat.
So they're not freaking out.
Not exactly. They've kind of integrated it into their public health systems.
Okay.
They have surveillance systems in place, biosecurity measures, and rapid response plans if there's an outbreak.
So they're not ignoring it,
Definitely not.
but they're not panicking either.
They're taking a proactive approach.
They've learned to adapt.
Exactly. And that might be something for the U.S. to think about.
So instead of just reacting to outbreaks,
Right?
we need to be more proactive.
Yep. Thinking long term.
And that means investing in public health infrastructure, supporting research, building trust with communities.
All of that. It's an investment in our future.
Okay, so much to think about.
There is.
This has been a really eye-opening conversation.
I agree.
I feel like we've just scratched the surface, though.
We have. There's always more to learn.
Okay, well, on that note, let's move on to part 3,
Sounds good.
where we'll dive even deeper into this crazy world of viruses, public health, and what it all means for us.
Okay, so we were talking about how other countries are handling this H5N1 risk.
Yeah, like they've kind of accepted that it's not going away and they've just built systems to deal with it.
Right. They figured out how to adapt, and they're constantly tweaking their strategies as the virus changes.
And as we learn more about it, too.
Exactly. One thing that really stood out to me in that Wikipedia entry was that it mentioned H5N1 being endemic in bird populations.
Especially in Southeast Asia.
Yeah, it's just become a part of the ecosystem over there.
Which is kind of a scary thought.
It is. It means the virus is constantly circulating in those bird populations.
So they're basically dealing with this all the time.
Pretty much. It's a never-ending challenge, especially with all the poultry farms.
Right, and all the interaction between wild birds and domestic birds.
Yeah, it's a complicated situation.
So how do they manage it?
Well, they have these really strong surveillance systems to track the virus in birds,
Okay.
and they have strict rules on poultry farms to prevent the virus from spreading.
So like biosecurity measures.
Exactly.
Hmm.
And they have plans in place to respond quickly if there's an outbreak.
So it's not about wiping out the virus completely.
Right.
It's about controlling it.
Yeah, keeping it in check, minimizing the risk to people and animals.
So do you think that's the future we're looking at here in the U.S. too?
I think it's a real possibility. We're seeing more and more outbreaks.
Yeah.
We might need to start thinking about this as something we're going to have to manage long term.
So a shift from reacting to outbreaks to actually preventing them.
That's the idea. Being proactive instead of reactive.
You know, it's almost like we need to accept that we share this planet with a ton of other creatures.
Right.
And sometimes that means we're going to get sick.
It's the nature of things.
But we can't just try to separate ourselves from nature.
We can try.
But it never works.
It's impossible. And it's actually harmful in the long run.
Yeah, we're part of these ecosystems.
Whether we like it or not.
And our health depends on the health of those systems.
Which is exactly what the One Health approach is all about.
Right, that idea that human health, animal health, and environmental health are all connected.
It's all one big web.
So this isn't just about bird flu.
No, it's about so much more.
It's about how we interact with the world around us.
It's about understanding that our actions have consequences.
For ourselves and for the planet.
Okay, so we've talked about the global context, the risks, the precautions.
Yeah.
But I think our listener is still wondering, what does all this mean for them?
Right, like, what's the takeaway message here?
First of all, don't panic. This is a serious situation, but the risk to most people is still low.
So be aware, but don't freak out.
Exactly. And second, take those simple precautions we talked about.
Like avoiding sick birds, washing your hands, cooking your food properly.
Those things really make a difference.
And third, trust the science.
Vaccines are one of the most powerful tools we have to protect public health.
So don't believe everything you read on the internet.
Right. Talk to your doctor. Do your research. Get your information from reliable sources.
Because misinformation can be just as dangerous as a virus.
Absolutely.
No.
Okay, so we've covered a lot of ground today.
We have.
From the Louisiana case to the global implications of H5N1.
Any final thoughts before we wrap up?
Yeah, here's something to think about.
Oh.
We've been talking about H5N1, but what if another virus emerged?
Oh, boy.
Maybe something even more contagious or even deadlier.
Okay.
Are we really ready for something like that?
That's a scary thought.
It is, but it's something we need to consider.
Yeah, this isn't a one-time thing.
Right.
This is an ongoing challenge.
And it's going to take all of us working together to face it.
Scientists, public health officials, governments,
Everyone.
communities.
Everyone.
Well, that's a lot to think about.
It is, but it's important.
It is. Okay, well, on that note, I think we're going to wrap up this deep dive into H5N1.
Sounds good.
Thanks for joining us, and a huge thanks to you for sharing your sources with us.
You bet.
We hope you found this conversation helpful and informative,
I hope so.
and maybe even a little inspiring. Because knowledge is power.
Couldn't agree more.
And the more we understand about these challenges, the better equipped we are to face them.
Exactly. So stay curious, stay informed, and stay healthy.
We'll see you next time.